Hello everyone, and in this video I'll be discussing something called new drug development. Sir, what is new drug development if you ask me? Suppose you want to discover a drug for COVID-19, that is corona. How do we start? Now that can be started. First of all, to start a drug discovery or a new drug development, what do you want to find out? The first thing is to find out the source. So in new drug development, the first thing what we need to do is find out the source of the drug. Once you get the drug, then what you are going to do is test them on animals. So we will do something called animal study. So once we are done with animal study, then we will check what happens in humans. So we do it on humans. So that is called the human study. Right? So these are the three important aspects what we do in a clinical trial. So number one, find out the source. Number two, do the animal study. And number three, you have to do the human study. The animal study is also called by a name called pre-clinical trial. So animal study is also called as pre-clinical trial, and a human study is also called by a name, and that is called clinical trial. So most of your questions in the exam come from clinical trials only. But you should know the process properly. So I'll go one by one what I have discussed. First I will tell you how do you find out the sources. So what is the source of the drug? Where do you get it? So you all know that from the ancient times we have got the drugs from plants. For example, if you remember the zinc alkalides, they are obtained from plant. Reserpine is obtained from the plant. Digoxin is obtained from the plant. So they have given us. The second important aspect is from the animals. Yes, we have got drugs from animals. For example, heparin, insulin, anti-snake venom, they are all from animals. Number three, what we can expect is from microbiological source. Classical example is penicillin. We know that penicillin is obtained from a fungus called Penicillium notatum. So we have got from the microbiological source also. Apart from that, the other source are mineral source. For example, if you want iron preparations, calcium preparation, we got it from minerals only. Then we have another source, that is the synthetic source. So what do you mean by synthetic source? They are nothing but where you synthesize the drug in the lab. For example, aspirin is nothing but acetyl salicylic acid which you can synthesize in the lab. So you will get it easily. And later we have come up with something called recombinant DNA technology. So recombinant DNA technology. So these are the sources how we get the drug into the market. So these are the sources from where we get the drug. But recently what they have done is you started using computers for drug designing. So it is called as in silico drug designing. So with that you get plenty of drugs which bind to the receptor. So from so many, so it is called in silico drug designing. Right? So these are the sources. How do we get the drug? Now once we get the drug is in our hand. So now whom should I test this? I should test this in the next important aspect is animals. So what we have is the next important aspect is the animal study. So animal studies, we take animals. You know that we take mice, rats, rabbits, right? Dogs, monkeys for the trial. But usually what we use is the smaller animals like a rat, guinea pigs, rabbits like that. So in animal study, what is the major thing what we find out? The major thing what we find out in animal study is the toxicity of the drug. Because most of the animals may not have the disease only. For example, do you think animals will get COVID-19? All the animals? No. It's very difficult. So some of the diseases are seen in only humans, but only some diseases you can make it in animals. For example, you can make a rat diabetic, You can induce asthma, but not every disease can be manifested. That's why the major aim, what we do in animal study is check for toxicity. So the another important aspect what we check in animal study is efficacy. So if we have certain disease in the animal, then only you can check whether the drug works or not. So in the toxicity, we do it like this toxicity, the acute toxicity. Then what we do is the subacute toxicity, then chronic toxicity. Then we also check whether the drugs are teratogenic or the drugs are carcinogenic, or will they induce mutation, are they mutagenic. So these are the studies what we do in animals. So that is called animal study. What is the other name for animal study, guys? It is also called as preclinical trial. So if you remember, the major aspect what I am going to check here is toxicity is the major chunk compared to efficacy. So many a times we don't want to kill the animals. So what we do is sometimes we use in vitro techniques. We use cell culture, organ culture, tissue culture to check the drug efficacies and toxicities also. Okay, so now the drug has been done. We have done animal study. We found that in animals it's not so much toxic and it is safer to use in humans. Then only we start the trials in humans. So the next important aspect what we start in humans is the human trial. So the human study is the third aspect I told you. Now before I go to the human study, I want to tell you the process. So first of all, when you start a human trial, the first thing what you need to do is you have to do an application called IND. What does IND stands for? Investigational New Drug. So we have to apply something called Investigational New Drug application. So where should we apply this, sir? So I need to apply this to something called CDSCO. What is CDSCO? It is the Central Drug Safety Control Organization. I'll repeat again, it is the Central Drug Safety Control Organization, and the head of that is called DCGI. Who is DCGI? He is called Drug Controller General of India. So he will check the application, he will see where you got the source, he will see whether you have done the human trial, clinical, this thing. So he will check whether you have done the animal studies correctly. Once you are done with that, then only he will approve that. So after that, you can start the trial called phase 1 trial. Then we go to the phase 2 trial. Then after phase 2, we'll move on to another trial that is called phase 3 trial. So once we are done with this phase 3 trial, then you have to apply for one more license, and that is called NDA. You may ask a question, sir, what is NDA for? NDA for New Drug Application. So NDA stands for New Drug Application. So you have to apply. Whom do I apply this? Same thing, you have to apply for the CDSCO. Who is the head of that? Drug Control General of India. They will see that. So this is given for obtaining a license called marketing license. So you will get a marketing license, and then the drug is ready to come out of the market. That means it will be available everywhere. You can start prescribing. And after that, we do a trial called phase 4 clinical trial. We do a trial called phase 4 clinical trial. It is also called by one more name, that is called post-marketing surveillance. So until then, in this video, we have discussed the timeline. First, we find out the source. I told you where are the sources from. Then what we do in animal study, we check for mainly toxicity compared to efficacy. Both are tested. And we also check for pharmacokinetics in animals. Then we do human trials. Once we are confirmed that animal studies are better, safety is better, then only come for human trial. And I have given the timeline. That is, first one is the IND, phase 1, phase 2, phase 3, then marketing license, NDA, and then phase 4. Remember, when you are doing phase 1, phase 2, phase 3, for all this you require an approval from a committee called Ethics Committee Approval. So this is the committee which will see whether the trial is important or not. For example, if you want to do a trial, what is the trial? You want to keep a human being inside a refrigerator and see how many hours later he will die. So should we approve that trials? No. So that part of ethical consideration is taken care by this committee. So do we require this for phase 4 clinical trial? Ethics committee approval is not required. So that is one of the important questions they keep on asking you. Okay guys. So next I will be explaining you what are the different phases and what you want to keep in your mind. Okay, so moving on to the next important aspect, the clinical trial. So you all know that what is clinical trial. In the clinical trial, we test it on the humans. So in that, the first one is called phase 1 clinical trial. It is called as phase 1. And what is the other name for phase 1? It is also called as human safety pharmacology. So phase 1 is also called by another name, that is human safety pharmacology. Now you know that we found out the source, we did the animal study, but we have a drug. But the only worry what we are having currently to give it to a human is what if it causes adverse effect. So the major aim of the phase 1 trial is to check for safety. So when I give the drug, the patient may have adverse effect, or he may suddenly die because of arrhythmia. So the first thing what I want to check is safety. Now what is the population who take this trial? Whom do we involve in phase 1 trial? The people whom we involve in this, they are called as human healthy volunteers. Human healthy volunteers. Sir, why do we involve human healthy volunteers in phase 1 trial? Because the reason is simple, because adverse effect can be tolerated better by the patients or the human beings. Healthy human beings. Obviously, it is the human healthy volunteers who are healthy, they can tolerate that better. That's why the major aim is to find out safety, and the patients involved are human healthy volunteers. So they can tolerate the adverse effect better. Now, if they tolerate the adverse effect better, so one more thing what we find out is maximum tolerated dose. So we find out the maximum tolerated dose. What do you mean by that? So I will give 10 milligram to the patient. I will see any adverse effect. 20, no adverse effect. 30, no adverse effect. 100 milligram, he starts having gastritis, he will have chest pain. Then I will stop. So that is called maximum tolerated dose. Along with that, the other aims of phase 1 trial is to check pharmacokinetics, how the drug is absorbed, distributed, metabolized and excreted. So very rarely we check efficacy, rarely. Because if the patient doesn't have COVID-19, then how will you check whether the patient gets cured or not? What is the rare condition? Certain times, rarely we involve patients in phase 1 trial, that is very rare. And the patients are involved in case of HIV, in case of certain cancers, that is terminal ill patient, then we have to include them in phase 1. Otherwise, remember guys, phase 1 trial means human healthy volunteers. Sir, how many we should involve? Remember, you should involve around 10 to 100. Why sir very low? Because it's very difficult to get and we don't want to put most of them into the risk. So any trial you should know what is the aim of the trial, then what is the population, then you need to understand the type of study. So type of study what is involved in phase 1 trial is simple. It is called open label study. Sir, what do you mean by open label? So patient will know, or the healthy volunteer will know that he has been given a new drug. He knows it. That is called open label. So what is the duration? How many days it may take? The duration of this is around 1 to 2 years. So that is what we do it in phase 1 clinical trial. And recently the question had come, what is the major aim of phase 1 trial? It is to find out safety. Once you are done with that, we will find out maximum tolerated dose, and then pharmacokinetics. Efficacy is not going to be tested, only if there is patient, then only. So who are involved? Human healthy volunteers. Yeah. So let me move on to the next one, phase 2 clinical trial. Phase 2. So phase 2 is also called as therapeutic exploratory trial. So what do you mean by therapeutic exploratory? The meaning is, until now I have tested in only human healthy volunteers who doesn't have the disease. I have not tested in patient. So when I use the drug, I should be confirming that the drug works or not. So the major aim of this phase 2 trial is to explore whether the drug works or not, to confirm efficacy. Whether drug works or not. So if the drug works, then what I will do is I will check for dose ranging. What is dose ranging? For example, you all know that paracetamol we can give from 500, 600, 650 to 1000 milligram for fever. So what is the dose that works for this patient for this disease? We will find out that. Now what is the population we involve here? The population what we involve here is patients only. How many patients should we involve? Around 300 to 500 patients. You may ask a question, sir, do we get every time 300 to 500 patients? Never, because certain diseases are rare. For example, myasthenia gravis, you cannot get so many 300, 500 patients at one time. But diabetes, hypertension you get. Then you can take 300, 500. So that doesn't mean that every time you will take 300, 500 in all the diseases. Clear? Yeah. So the next important thing is populations are patients who have disease. So what is the type of study? The type of study is called randomized controlled trial. What do you mean by randomized controlled trial? So we take 100 people and divide them into 50 each. So for 50 people we give new drug. For another 50 people we give placebo, and they don't know that. So they don't know whether they are given placebo or they don't know they are given new drug. So it's a randomized controlled trial, and it is a blinded trial. So blinded means patient doesn't know whether he is taking the new drug or he is taking the placebo. So this is called phase 2 trial. And one special point about this trial is there is maximum failure. Maximum drug failure occurs in phase 2 trial. Please mark it. This is an MCQ asked. What is the phase of trial where maximum drug failure occurs? It's phase 2. Why? Because when we do the trial, what happens is the drug may not work. The COVID may not go away. The BP may not decrease. So the drug may not work. That's why if the drug doesn't work, it will fail in phase 2 and it will not go for further phase 3 or phase 4. What will be the duration? The duration of the study will be approximately 2 to 3 years. So this is the duration of study. And usually what we do is, this is done in 1 to 2 centers only. So we don't involve more places here. For example, we do it in Bangalore, we do it in Delhi, that's it. So once I am done and I confirm the drug works, then I want to check in large population. So then we move on to the next phase, that is called phase 3 clinical trial. Suppose the drug is working in Bangalore, in Delhi, but I want to confirm whether it works throughout India. So I cannot confirm by only 2 centers. I have to do it in multiple centers. Suppose in your exam they give it like this, the trial is done in multiple centers, obviously it will be phase 3 trial. So phase 3 is also called as therapeutic confirmatory trial. So it is also called as therapeutic confirmatory. So let us write what is the aim. The aim is to confirm efficacy. To confirm efficacy. Yes, sir, you have already confirmed efficacy, then why are you doing it? I want to confirm in large population. So it is done in large population. Right? So the aim is to confirm efficacy. Along with that, we always continue safety, pharmacokinetics in every phase of the trial. That will be there. Now, what is the population we take into consideration here? How many? Usually we take 3,000 to 5,000 patients. We take around 3,000 to 5,000 patients, a large population. So we do it something called multi-centric trial. So what do you mean by multi-centric trial? That means we do it in Chennai, we do it in Hyderabad, we do it in Mumbai. So every places. So that is multi-centric trial. So why should I test in multiple population? Because the drug, pharmacogenetics, for few people it may work, for few it may not work because of the genetic makeup. So I need to confirm. So recently the question had come that patients were taken 4 or 5, but it was done in multiple centers. So that's the reason I tell you the number of patients will not matter much if the diseases are rare. So what matters is how many centers they are doing and what is the aim of the trial. That matters when you answer which phase of trial you are dealing with. Then what is the type of study? The type of study what we do is same thing, randomized control trial. So what we do is here we compare a new drug with already a drug which is available. For example, a old drug. For example, we came with a drug for COVID-19 and already we had a drug, older drug, remdesivir, compare that. Then what's the duration of study? It's around 3 to 5 years. So it may take around 3 to 5 years, that is the duration of study. So the phase 3 is also called as therapeutic confirmatory trial. So once we are done with that, we are completing an important thing. That is the reason this trial is also called as pivotal trial. The meaning of pivotal means very, very important. So once you are done with phase 3, you confirm the drug works everywhere, it is safe, pharmacokinetically it is better, then we are done and we can apply for license. Okay, so we'll go for another trial, and before that I told you we have to apply for the marketing license, and the application what we call it as is new drug application. And can you recall where do you apply this? CDSCO, that is DCGI. Now we'll move on to the next phase, that is called phase 4 clinical trial. Now once the company applies for marketing license, you apply something called new drug application. Now when you apply for new drug application, when you get a marketing license, then why should we study this again? This phase 4 is also called by another name, that is called post marketing surveillance. So it is also called as post marketing surveillance. Now what is the aim of this? The aim of phase 4, that is post marketing surveillance, is to check rare adverse effect of the drug. Many times we may not get the adverse effect during the trial. Then we need to check for long-term adverse effect. For example, a drug is discovered for diabetes, patient take it for 20 years, 30 years or later, what may happen? That we will find out. For example, you know that pioglitazone increases the risk of bladder cancer. If I know that risk, I can stop the drug or I can give a warning. Then we want to check for drug interactions. We check for drug interactions, and also we check what happens in special population. Who are special population? The special population are nothing but pregnant women, children, lactating, as well as elderly patient. They are special population because we don't involve them during clinical trials. So we want to check what happens when we give the drug to them, whether they are safe, we can use them. That is found out in phase 4 trial. Now what is the type of study? The type of study is observational study. Just observe it. So any problem occurs, you just report that. That is why it is called observational study. And the duration, there is no limit for that. The duration is unlimited. And the population is also not restricted to 1,000. It can be extended anytime. So guys, this is what is phase 4 trial. So it is also called as post-marketing surveillance. Why do we do it? To check for rare adverse effect. long-term adverse effect, drug interaction, and to check what happens in special population. So these are the phases of clinical trial we have explained. Okay, sometimes there is one more trial they will ask you, and that is called phase 0 trial. Phase 0 is also called by a name called micro-dosing trial. Now why it is called phase 0? Because it is done before phase 1. Why it is called microdosing? Because the dose what we use is very minute, that is 100 microgram, or what we use in the trial is 1/100th of the dose used in animals. So lesser dose. Why do we do that? The aim of the trial is to check for pharmacokinetics. The meaning is how the drug is absorbed, distributed, metabolized, and excreted. Suppose I want the drug to work in a muscle and the drug is not going to the muscle only, then what is the use of doing the trial? So that will eliminate the drug there itself. So that will save the time, money for the company. So certain times they do this phase 0 trial, also called as microdosing trial. So please understand this clinical trial is very, very important topic, and they keep on asking you how the drugs are developed. So please understand, we find out the source, then we do the animal study. The main aim of animal study is to check for toxicity more than efficacy, because most of the diseases are not manifested in animals. The next important thing is, once you are done with that, we go for something called IND, investigation new drug application. We give it to CDSCO. Then we start phase 1 trial, that is called human safety pharmacology, where we take human healthy volunteers. That is the major aim. The major aim is to check safety. And then we move on to the phase 2, where we explore whether drug works or not. And we do it in 1 or 2 centers, and we compare with placebo or we compare with old drug, but we do it in 1 or 2 centers. But maximum drug failure occurs in phase 2 trial. Once the drug passes phase 2 trial, then we go for phase 3 to confirm the efficacy in larger population. So we do it in multiple centers. And once this is done, the pivotal trial is ready. The pivotal means important trial. Then the company will apply for new drug application and they apply for marketing license. Once they get it, the study what we do is called phase 4, also called as post-marketing surveillance. Why should we do it? The reason is simple: to check for rare adverse effect, long-term adverse effect, drug interaction, and what happens in special populations. So that's it in this video, that is new drug development. Thank you all.